Good morning, everybody in the UK, and good afternoon to all our colleagues and listeners in ASEAN. My name is Paul North with the UK-ASEAN Business Council, and I would like to welcome you all to our UK-ABC Digital Export Series, Opportunities in Southeast Asia's Healthcare Sector. Over the past decade, Asia's healthcare markets have grown exponentially, and growth that far outstrips that of more developed markets in Europe and America. We will investigate the healthcare sector in the Asia-Pacific region and consider the future potential scenarios for ASEAN's healthcare markets. We will also discuss the ways in which doing business may need to alter to ensure continued relevance and success. Today we will hear about those challenges and opportunities from our guests. We're delighted to have Talia Giorgio, who is the Managing Partner at Asia Care Group, which is based in Singapore, and our colleague Rahul Agarwal, who is the Asia Pac and Prosperity Lead at the Department of International Trade in London. Before we start our presentations, just to let you know that all attendees are in mute mode, and you can send in at any time questions for our presenters through the question box in the lower section of the webinar dashboard. We will endeavour to answer these during the Q&A session at the end of the presentations. The webinar will be recorded and will be available on our social media channel shortly after. So let me just set the scene for the event. Next slide, please. The Association of Southeast Asian Nations was established in 1967 to accelerate cultural development, economic growth, and social progress throughout the region. And since 1967, it has grown to include those 10 countries you see there on the slide, all very diverse economically, culturally, and politically, from the high-tech market of Singapore to the recently opened up market in Myanmar, a country that has nothing and needs everything. It has a young, dynamic consumer market with a population of over 630 million and an average age of just 26. It is where the growth is, or was pre-COVID, and like all markets are seeing a decline in its economy. However, it is predicted that because of this strength, ASEAN will be one of the first economies, if not the first region, we've heard from some analysts, to bounce back and to bounce back even stronger. Next slide. The UK-ASEAN Business Council is the leading UK-based organisation promoting trade and investment between the UK and ASEAN's dynamic markets. Not just to drive that pipeline of UK companies looking to do business with Southeast Asia, but also acting as a conduit for ASEAN companies looking for partnering here in the UK. We help companies of all sizes build new contacts, provide market insights, and raise the awareness of the vast commercial opportunities. We also bring ASEAN to the UK through a sustained calendar of events. I would encourage you to visit our website, ukabc.org.uk, where there's a considerable amount of information about our events, both here in the UK and in ASEAN, and a lot about doing business in the region. So without further ado, may I introduce Talia from Asia Care Group, just to give a 5-minute introduction on what you do. Thank you, Talia, over to you.
Thanks very much, Paul. So good afternoon to our colleagues and clients in the region. I've had a quick look at the attendee list, and I think many of you know who we are, but for those that don't, we are a specialist healthcare consultancy firm. We work only in the APAC market, and we have offices in Hong Kong and Singapore, and we work right across the industry spectrum with governments, with private health insurers, private provider organisations, and a range of other entities such as development banks. And our real goal is to try to ensure the efficient development of sustainable healthcare systems. So everything we do really is within that vein. And I'll keep it short and hand back to you there, Paul.
Thanks, Talia, for that introduction. Can I now bring Rahul in, please? Rahul, and just give us an overview of yourself and what you are doing for Healthcare UK.
Yeah, sure. So my name is Rahul Agrawal, and I work for Healthcare UK, which was established in 2013. And it's a joint initiative from the Department for International Trade, NHS England, and the Department for Health and Social Care. Our mission is basically to support UK healthcare to export their expertise to improve the economic and social well-being of the UK through global trade. And we also work very closely with our life sciences sector at DIT. We have 5 campaigns, of which Southeast Asia is one of them, which started in 2018. And we support UK companies in Indonesia, Malaysia, Philippines, Singapore, and Vietnam. And we have a team working on the campaign based both in the UK and across the region in ASEAN, including in UK embassies and high commissions. And we also have a campaign in Northeast Asia and Thailand, so I'm happy to be contacted about those if you're interested in other regions as well. What the support that DIT gives includes market information, international trade advisors and regional support, introduction to potential buyers, both in the UK and overseas. And we also work on market access barriers, as well as events and trade missions. Next slide. I'm just going to quickly go into why we're interested in the region, and Thalia will go into this in greater detail. But what we're seeing is 5 key trends that are driving opportunities for the UK in Southeast Asia, and why the UK government is interested in it. So these include the following. So people in Asian economies are aging, which is increasing the need for complex care. Secondly, we are seeing the rise of non-communicable diseases such as diabetes, cardiovascular, and mental health. And these are the new epidemics of economies as they develop. Overall, the region is looking for solutions to these to emphasize affordability and manageability, and lots of sort of frugal innovations and local R&D is sort of the trend that we're looking towards. Thirdly, these economies are looking to turn the vision of universal healthcare coverage into a reality, with particular focus on primary care, prevention, and quality of care, seen as government priorities. And a lot of these nations as well have young populations with lifestyles that are increasingly connected to smart technology, and therefore health tech and med tech are responding to these. And why is government really interested in this region? I think one of the key points is that the NHS and the UK life sciences and academic sectors are really highly regarded, and they have really good historical links in the region. And what we are seeing in government is that we want to harness these connections, especially as competition from other nations continue to rise. I'm not going to go into too much detail, but at Healthcare UK, we have actually developed the UK offer that we promote in the market overseas. And this is just a good compass to summarize the commercial opportunities, as this is basically where we think the UK strength lies. And we've developed these 6 areas through engaging business and the NHS. So these include clinical services, so consulting in delivery and innovation, say cancer, diabetes, genomics, digital health, so pioneering innovation in the healthcare, including big data, AI, app development, EHR, and telehealth. Education and training, so this is very much around using UK knowledge and expertise around clinical sort of leadership and management and consultancy and advisory. Infrastructure services, which includes hospital design and builds. An emerging offer around healthcare system development, and I will talk more about this later when I talk about the Prosperity Fund, which includes harnessing our best practice around patient safety, pharmacy, clinical regulations, and prevention programs. And finally, we don't deal with this so much in Healthcare UK, but again, we're working closely with our life sciences colleagues around life sciences. So med tech, clinical innovation, research, precision medicines, pharma, and diagnostics. So this is just a sort of a whirlwind summary of where we think sort of the opportunities are and what we've developed at Healthcare UK, as well as the trends.
Thank you, Rahul, for that introduction, most informative, and it's great to hear that Healthcare UK are supported in those particular regions, and that there is support for UK SMEs available. And I'm sure we will have probably a couple of questions coming up on how UK companies now can hook into that agenda. Thank you very much, Rahul. So I'd like to go back to Thalia now. who will do her presentation regarding the impact of a global recession on healthcare markets in ASEAN and the opportunities and the risks that are associated with that. Over to you again, Talia.
Thanks very much, Paul. So I thought I would just begin by perhaps explaining how we go about opportunity prioritization with our clients, because I think it helps frame the rest of the presentation. But very briefly, what we try to do is actually think about challenges that healthcare systems and services are facing. We look at the scale of those challenges, we look at how they relate to one another, we look at which are the most important to solve for in resolving health system challenges, and then we begin to think about what solution groups might need to be in place to really respond to those challenges before then thinking about how individual groups or entities can access those opportunities. So I will talk quite heavily around the challenges, both those that exist and those that are emerging post-COVID, and then at the end begin to highlight what that means in terms of opportunities, and then Raul will go into detail around what that looks like for individual markets. So if we move to the next slide, this just gives a quite nice overview of what we've seen historically and what we think will happen in terms of overall GDP growth and healthcare spend. So you can see on the left-hand side graph, this is a historic look at compound annual growth rate of health spending versus GDP. And you can see that in most markets in Asia, GDP growth has been very strong, and it's definitely outstripped GDP growth that we've seen in established markets like the UK. And for some markets, particularly the more advanced ones like Singapore, that's translated into very significant increases in terms of health spend. Interestingly, for countries like Vietnam and Indonesia, who have moved towards universal healthcare, although they are beginning to make substantial investments in healthcare, their GDP has outstripped the healthcare increases. So we haven't seen as much investment within those systems, and that will have implications in terms of the resilience of those health systems to really weather what we're going to see in the coming at least 2 years, but probably substantially longer. So if you look at the right-hand side, this is our prediction of what we think is going to happen in the near term. So the next couple of years, really around healthcare spending and GDP. We've used the IMF's growth figures to look at what we think is going to happen with GDP. So as you can expect, the numbers are much lower than we've seen historically. So coming down to single digits, and in some cases, like Singapore, it being very low indeed. And in fact, I was just checking the numbers this morning, and I think these are probably generous predictions. We will probably see GDP growth, perhaps even in the minus figures. So it is going to have implications for healthcare spending. Our view of what we think will happen is for those countries where they've seen very high GDP growth and kind of modest increases in healthcare spending, like Indonesia and Vietnam, which I've mentioned, we think we'll begin to see a greater degree of parity between health spending and GDP. We don't expect there to be significant reductions in health spending in those countries, primarily because they have invested so much in trying to get universal healthcare off the ground. But we will see something of a realignment between GDP and health spending. And in more advanced markets like Singapore, what we'll actually see is a real-time reduction in health spending. So there will be even greater pressure on doing more with the available spend that is available. If we move to the next slide, please. So this creates a number of potential opportunities, also risks. For those of you that are on the call that are from the private payer environment, this could potentially be good news. We will see governments really struggling to be able to finance healthcare in the near term, even though this whole crisis has been spurred out of a health event. There's so many pressures on spend, government spend, right across the board in emerging economies. So what we will tend to see, we think, is an increase in out-of-pocket spending as that government spend perhaps reduces down. And what we tend to see across markets globally is where you have very high out-of-pocket spending, that's usually a very good indicator that private health insurance penetration rates will start to increase. So on this graph, we've just shown you Singapore's a bit of an outlier, as you can see, but we've just tried to show you the amount that's spent out of pocket across the different markets and the insurance penetration rates. And you can see already, just very simply from this visual, that there's a real need for increased private health insurance and a real opportunity given the comparatively high levels of out-of-pocket spending in many countries. We move to the next slide, please. We move to the next slide, thanks. So one of the issues that I think will face private payers in being able to develop affordable health insurance products is really around the issue of medical inflation. As many of you that are operating in the region will know, medical inflation has tracked very high and often outstripped growth in GDP. So obviously we've got a shrinking GDP and we continue to see high levels of medical inflation. There will be a risk to that potential opportunity of increased product penetration rates. So there's really a need to rethink the way in which healthcare is delivered and to try to reduce down, however we can, this very high level of medical inflation. Our view is medical inflation will come down, and there's some reasons which I will explain later in the deck why we believe that will happen, but it's primarily related to the pressures that are on providers and the changes we anticipate within the provider landscape and the behaviours of providers. We move to the next slide, please. This is just another very nice way of illustrating this whole challenge. And if there's anyone from Swiss Re on the line, I have to thank them for their work in this space. This is the health protection gaps that are being quantified by Swiss Re across the region. So health protection gaps are defined as that out-of-pocket spend together with catastrophic or unaffordable health expenses that individuals are facing. When you put those two things together as a composite, you get a sense of just how underserved or underinsured individual populations are. And the numbers here are quite staggering. So there is a huge opportunity to try to close these protection gaps, but it comes against that backdrop of affordability, and that's going to continue to be really a very near and present challenge for everyone working in these markets. We perhaps move to the next slide. So another very significant challenge that we have across the ASEAN markets is the level of wealth and income inequity, which we know from history tends to be exacerbated at times of financial stress and economic stress on healthcare systems. So this graph is quite interesting. On the right-hand side, you can see the UK, which actually globally fares reasonably well in terms of the distribution of wealth throughout the population. But in Asia, it's quite a different story. So in emerged Asia, Hong Kong and Singapore, they tend to follow a very capitalist model, which means that you have a small pocket of ultra wealthy individuals and a much broader population who really aren't anything near to the top of the pyramid. And so you see this huge wealth inequity. We've here used the Palmer Index, which some of you will be familiar with. This essentially takes the wealth share from the top 10% of the population and divides it by the wealth of the bottom 40% in order to come up with the score. And so, like I said, you can see the capitalist markets at the end of the spectrum. And what we see in Asia is that they're all tending to migrate towards the Hong Kong, Singapore model. And so you've got the very early stage economies like Laos, right down there, nearer to the UK actually, in terms of wealth inequity. But as countries become wealthier, you can see Malaysia there, you can see Thailand, they tend to migrate towards this highly polarized wealth distribution curve. And that, of course, has implications for the types of ways in which healthcare systems have evolved. So what we tend to see in markets like Hong Kong and Singapore is that you have this sort of safety net service which is available on the public sector, very low amounts of healthcare spending going in, single digit, maybe 3-4% of government expenditure going there. And then you see these small but incredibly expensive private healthcare systems emerging, and nothing really in between. And that's a problem because as we begin to get those middle-class consumers, if there isn't a middle sort of tier within that deeply polarized environment, it is going to hamper the moves that countries want to make towards encouraging individuals to invest in their own healthcare. So this context of wealth inequity is very important, and unfortunately what we know from previous recessions is that these wealth inequities do tend to be exacerbated. So let me just talk about what that means in terms of the way in which care has been structured. I mentioned just before, but I think another way of illustrating it is on the next slide. So here what we've done is we've tried to look at the cost of a treatment, in this case a hip surgery, hip replacement surgery in the public sector versus the private sector. So on this graph it's the amount of times more that it costs within the private care space. You can see we've always used UK as a comparator. As you would expect, private care is more expensive than public care, and this is the amount that it actually costs the system rather than the amount that individuals pay, because of course we know in the UK individuals don't pay directly. And so you can see that private care is more expensive, but it's not as expensive as you see in some of the markets in Asia. And that's, as I mentioned, related to this this kind of emergence of a real kind of wealth disparity, which is why this situation has arisen historically. However, as we move forward and there is this context of affordability, we absolutely need to see some of these prices come down and be, yes, as you would expect, a little bit more expensive than the public system, but not so much more that it becomes unaffordable for individuals to either pay for these out of pocket or to have an insurance product that would comprehensively cover them. So our view in terms of what we expect to see happen is actually that those prices will begin to come down across Asia. We've been tracking bed occupancy in private hospitals for a number of years, and you can see here in the graph the bed occupancy across a number of different markets. I think what's interesting is bed occupancy has never risen to the point that you would expect to see in some other markets. So it's on a good day perhaps hovering at around 60%, but some countries have been much less than that. And we've also seen a huge level of investment. It's always an appealing thing for an investor, I think, to have a hospital. It's bricks and mortar. It's a physical asset. And until recently, they've been seen very much as real drivers of profitability and revenue. But we have started to see, even before COVID, a reduction in some markets like Malaysia in the occupancy rates. And that's been driven by this oversupply of hospitals at a time when actually the alternative to hospital care is really what countries need to be considering. So we've seen this oversupply pre-COVID, and then of course COVID has come along and individuals have postponed elective treatment and have even rethought some of the work that perhaps they were going to have done, which was more in the preventative space. So preventative colonoscopies, which is actually a thing in Asia, and lots of other investigative type work which has been done in a hospital environment. So based on what we know of Asia, what we've seen historically, what we know of medical tourism, which has also fueled the revenues of some private hospitals, particularly in Thailand, Singapore and Hong Kong, we've come up with some predictions of what we expect in 2021 on the right-hand side. Sorry, if we could just go back. There we go. So on the right-hand side there, you can see our prediction for what we expect to happen in terms of bed occupancy. So all within the minus figures, unfortunately, with some markets really seeing very significant double-digit reductions in bed occupancy. And what that means is that there are going to be, and there in fact already are emerging, some significantly distressed assets. Hospitals have often, when they've had large reserves, invested them or reinvested them in additional hospitals in other parts of the region. So there's very few hospitals that are sitting on huge reserves to be able to weather a storm such as we're seeing now. So distressed assets are becoming a reality. That creates a number of opportunities. If you're looking at getting into the market, then the valuations of healthcare assets are beginning to come down, which is a really good thing. So a buy model for market access is becoming more viable, but it also opens an opportunity for private insurers to be able to perhaps guarantee some volume in exchange for a heavily reduced price, and that will help allow hospitals to be able to get loans and so forth against that, and therefore be able to make it through this financial period. So there are some challenges if you're a private provider right now, but there are also opportunities on the flip side of that as well. We move to the next slide. I mentioned that even before COVID, one of the issues facing private providers was the fact that the model of care that was being offered was perhaps a little outdated and certainly far too acute focused. We can see on the left-hand side sort of place of death for individuals. And you can see that in Asia, we tend to really institutionalize towards the end of life, which means that there are often elderly patients sitting in hospitals waiting to die for very, very long periods of time. And I'm not just talking weeks, I'm talking months at a time. The care facilities outside of hospitals, so district nursing, community nursing, these sorts of things, which we take for granted in the UK, are massively under-evolved. And telemedicine, remote monitoring, all of these sorts of things which could play a big role in helping revitalise and improve care models are really not getting the penetration that they need. There are some cultural issues here. There is a cultural preference for hospitalisation at end of life. But these things are of course increasing cost quite significantly, so we expect they will be looked at with fresh eyes as we go into a very challenging economic environment. And it's not just an end-of-life care, just generally speaking, there's an overly acute model, and we have a lot of people going direct to specialists. The role of GPs is heavily under-evolved. Again, cultural preference for going direct to specialists and a lack of understanding about what a GP could offer and why you would go and see one. We also have the doctor shopping phenomenon. So if you go to a doctor and you don't perhaps like what they're telling you, there is a cultural norm of going to multiple different doctors until perhaps you settle on something that you feel comfortable with. So so we have this this also driving costs within the system. We expect that kind of thing to perhaps reduce down a little bit. Obviously, people don't have as much disposable income to be able to do that, so that may create an opportunity for instilling a different model, particularly of primary care. We also have, and this is something that insurers are looking to manage, what we would call buffet syndrome. So as soon as they get health insurance, particularly if it covers both inpatient and outpatient, overutilization of care because they're on heavy co-pays. So we see some of these challenges within the healthcare system. If we can move to the next slide. Sorry, if we could move to the next slide. Yeah. So just to wrap up, really, what does this mean for companies that are looking to operate within these markets? This is quite a busy slide, difficult to present, but I thought I would just give you a sort of insight into how we begin to think about these things. So you have the challenges, some of which I've walked through on your left-hand side. These are, of course, just a snapshot. There are many, many more challenges. And then we've started to think about the types of solution groups that might work well, and examples of those. So maybe if I just take the first that we've talked about in some detail, we've talked about pressures on healthcare spending and unaffordability of private healthcare. So in terms of what we would be looking for solution groups, anything that can help hospitals, or particularly public hospitals, reduce down that activity level and support out of hospital care, efficiency orientated solutions and so forth. So they might be IT systems, they might be therapies which keep people out of hospital. Just some very quick considerations. I'm sure we will talk about these later on. But operating in Asia is of course very different to operating in other parts of the world, and accessing some of these opportunities might require a different thought process, and particularly bringing in other partners, be they development banks, investors, insurance companies if you're a payers if you're an insurance company, in order to access some of these opportunities is very important. I think we can talk about that more when we go to the Q&A session, but we certainly would want to share with you some of our thoughts around market access as well. But I know that we're short on time, so I will hand back to Paul, and I think Raoul will be going through the individual markets.
Lovely, thank you very much, Talia, on that really informative presentation. I just want to ask you something really just before we move on to Rahul very, very quickly, because we did have a comment in. We're getting quite a few questions coming in as well, so thank you very much, audience, and please keep them coming in. We're going to have time to answer those. But it was just a comment really that was brought through on regarding the medical tourism, which you touched on, and that some of possibly of the not so much developed countries would lose a significant share of that, because obviously residents are travelling to the likes of Singapore and Malaysia. So it's just a quick comment on how that could be addressed to secure those domestic markets.
Yeah, I mean, it's interesting. I think what this situation may do is force individuals within Indonesia or Malaysia to actually use local private care rather than travel to Singapore or Hong Kong for care. Now, it really depends on what the experience is as to whether or not domestic markets are able to help secure and offset some of that medical tourism in the longer term. But I do think travel restrictions will be heavily in place for many months to come. So it does present an opportunity for those domestic markets, and obviously a massive risk for those that are on the receiving end.
Lovely, thanks, Talia. Great. Okay, let's move straight on to Rahul now, and Rahul, if you could start your presentation on the overview of the healthcare landscape in ASEAN, please.
Sure, definitely. So if we go to the next slide. So just to give, before I go into the individual markets, just want to give a bit more on what UK government is doing at a bigger picture. So DIT's aim is also to open markets for UK businesses to trade and invest in the Asia Pacific region. And we are actually doing a lot to build strong trade relationships with our partner countries. to identify opportunities, resolve market access barriers within them, and influence trade policy. And this does include healthcare and life sciences. And through bilateral trade relationships, what we're doing is we're identifying key barriers for both markets, but also engaging in sort of opportunities through various forums, dialogues, and joint committees. We also have specific programs as well that are hoped to foster better economic partnerships, specifically in healthcare. And I was asked to talk a bit more about the Prosperity Fund. The Prosperity Fund is a new cross-governmental program, and it's a new method of looking at trade and development. There are 23 of these across various sectors, from energy to education, and also countries such as Colombia program, India program, etc. Specifically, what they do is that they deliver a primary benefit through a UK aid-funded program, which improves economic development and welfare in partner countries. And as these countries develop and build more sectoral sort of partnerships with us, it's hoped that secondary benefits through new commercial opportunities are also delivered to UK and international business and public sector through these mutually beneficial economic relationships. So one of the programs that is included in the Prosperity Fund is a Better Health program, which was developed in consultation with the Department of Health and Social Care, Trade and Development. And its primary purpose is to increase life expectancy, productivity, and economic growth in 8 partner countries, including in Southeast Asia, which is in the slide here. It has 5 key pillars. Again, they're in this slide, and includes everything from life sciences to quality improvement to digital health. And the idea is that these will be delivered by delivery partners, but critically, it's overseen by a strategic partner of a consortium of ALBs in the NHS. What Healthcare UK and DIT is doing is working with these delivery partners and this strategic partner, as well as the SEO, to look at secondary benefit opportunities for UK business and obviously international business as well. So again, I will share my contact details after this. So if you want to know more about this, I'm happy to have a conversation about it. So moving on to individual markets, if we go to the next slide. So I'm going to go through the 5 key markets that we look at. In this slide is a summary of the key opportunities, as well as just a bit of information. So starting off with Indonesia, and a lot of this will build on what Thalia presented as well. So Indonesia is a growing economy, and PwC does predict that Indonesia will be the 4th largest economy in 2050. And although many of the approximately 17,000 islands that make up Indonesia are not inhabited, one of the challenges facing Indonesia is delivering healthcare to a large population across numerous islands. What we're seeing is digital healthcare initiatives are being implemented in both public and private healthcare sector in Indonesia. For instance, the government digital health initiatives on hospital-to-hospital telemedicine and teleradiology for hospitals in remote areas is one example of many different initiatives that's happening in Indonesia. And much like other large countries in the region, digital healthcare initiatives can go a long way in bridging that distance and delivering efficient healthcare systems in remote areas. What we saw when we went to Indonesia is that it can also provide more convenience to those living in cities. And one of the companies that we engaged was Halodoc, which is an indigenous Indonesian company that's actually using smart technology to provide care accordingly. And then finally, there is a new capital planned in Indonesia, and there is potentially what we're seeing potential opportunities in hospital builds and opportunities in infrastructure, but not just the design of the infrastructure, but also the sort of supply of medical devices and equipment accordingly to these. I wouldn't say that Indonesia is the most easiest of markets to engage with out of the 5 that I'll be presenting, but it is a critical market that we're interested in developing relations with. Moving on to Malaysia in the next slide. So Malaysia has an open economy, and approximately 40% of jobs in Malaysia are actually linked to export activities. So in terms of ease of doing business, Malaysia is definitely slightly easier than Indonesia is. And healthcare is delivered both through public and private providers, with the government subsidizing public healthcare with a fee for the patient and with private healthcare as well. Over the last couple of years, the Malaysian Health Ministry has increased its efforts to overhaul the system and attract more foreign investment. And we have been engaging Malaysian stakeholders to discuss specifically digital healthcare innovation in the UK and collaboration opportunities accordingly. So there are significant opportunities in EPR, big data, telemedicine, as Malaysia pushes forward its digital innovations sort of initiatives. As Talia mentioned as well, Malaysia is also a popular destination for medical health tourism. And among a broad range, this is particularly in areas such as fertility, orthopedic care, oncology, and cardiology. So these are, again, real strengths for the UK, especially in the NHS and the public sector when you think about consultancy. And also, due to cultural diversity in Malaysia, patients aren't just from Malaysia, but also coming from ASEAN. So we are seeing this potentially as a hub for our clinical services kind of offer that I explained before. Finally, there are a number of UK universities also successfully operating and offering education programs in Malaysia. So there are opportunities in both tertiary education and observerships for universities, trusts accordingly in that. Moving on to Philippines. So the Philippine government has been pursuing reforms in the healthcare sector, devolution of healthcare services to local governments, fiscal autonomy for government hospitals, use of generic medicines, and the establishment of national health insurance system in the country, all to better improve health outcomes. A larger portion of the 2020 national budget was allocated to healthcare with the aim to upgrade medical infrastructure and expand universal healthcare scheme to all Filipinos by 2022. And what we're also seeing is large private conglomerates also investing heavily in the healthcare business. So that includes companies like Metro Pacific and Ayala Health in Malaysia. In terms of opportunities for the UK, again, digital health is an important offer to address the challenges in patient data management, rising healthcare costs, and accessibility of underserved areas in the archipelago. We're also seeing opportunities in health education and training, especially around the fact that Professional Regulation Commission estimates that approximately 67,000 nurses alone obtain licenses in the Philippines annually, and as such, demand necessitates higher quality education and training to improve the quality and capabilities of healthcare graduates. On NCDs, cancer and diabetes are two of the most prevalent NCDs in the Philippines, and again, we're seeing public and private sectors poised to invest in these areas, particularly, for instance, in new cancer hospitals. And then finally, rural health units, health centers, and private clinics remain the backbone of primary healthcare in the Philippines. So again, that points to a key strength of the UK, which is around primary care, and again, around our sort of reputation of increasing accessibility to population around healthcare and better outcomes accordingly. Moving on to Singapore as we fly around ASEAN. So Singapore is overseen by the Ministry of Health. Healthcare in Singapore is offered by both the public and private sector. So you're seeing 80% secondary care, 20% primary care. So Singapore definitely has a stronger primary care sector compared to the other countries that I've mentioned. Again, when you talk about ease of doing business, it's definitely the top. We at Healthcare UK actually consider Singapore to be closer to the developed countries, and we consider it to be closer to Japan, Korea, and Taiwan, who we also have networks in. Healthcare spend is currently at 4% of GDP in Singapore, but it is one of the fastest aging populations in the world. So 1 in 4 will be over 65 in 2030. So again, this leads to opportunities for a full range of products for the elderly, from digital to social care to aids for daily living. And indeed, the government has actually started looking at how we can harness the aging grand challenge, which is in our industrial strategy, to actually promote the UK's excellence in this from an investment and an export point of view. The Ministry of Health has also outlined the 3 beyonds, which is basically beyond hospital to community, beyond healthcare to health, and beyond quality to value. And there's lots of healthcare is a key strand to Singapore's Smart Nation initiative for increased use of technology across all areas, from prevention to management, and from acute to home care and mental health and resilience. So you can see how the sort of bigger picture of the Ministry of Health is connecting back to how they want to deliver a sort of smarter nation when it comes to healthcare delivery. We're also exploring new models of care delivery with Singapore, so how we can share UK's integrated model and social prescribing strategies. And also, we're seeing that Singapore is actually a great place to launch new innovations, and a lot of innovative UK SMEs are actually delivering their healthcare solution in the market because it's very open to adopting new sort of technologies. We actually spoke to the NHS Innovation Accelerator, who's a sort of HSN-run program, where lots of SMEs actually said to us that they're looking at Singapore as sort of the first market that they go to for their solution. And then finally, Vietnam. Vietnam is a very interesting market. We're very interested in Vietnam, but again, it's a much more difficult market probably to break into for UK companies compared to Singapore, Malaysia, and Indonesia. But there are three key drivers for healthcare spending in Vietnam. So strong economic growth, a rising population, and a growing middle class. So it is an economy that we're very interested in. Key trends in Vietnam include an emerging aging population. So Vietnam population is enjoying a golden structure with half the population under 30. However, it is expected to begin the aging trend. There's also, again, increasing burden of chronic diseases in Vietnam, the most common being cardiovascular, diabetes, and cancer. And finally, there's a growing demand for quality healthcare and also for private healthcare as well. So you're seeing that the healthcare system is changing. It is starting to look to become a bit more a bit more innovative and adding new ideas to it. So there is a high adoption of technology, and the government has introduced measures requiring hospitals to introduce electronic patient records, and also lots of interest around hospital information systems, AI, and telemedicine. And finally, the Ministry of Health is also looking at how to strengthen healthcare education and training. And this again opens up opportunities both in training healthcare professionals and in ongoing continuous professional development. So that's basically sort of a summary of all the countries. I will just mention quickly life sciences as well. Again, Healthcare UK, we don't deal directly with life sciences, but we do work in close collaboration with our life sciences colleagues. And we are actually seeing that the key sort of countries for life sciences right now, and we've added life sciences campaigns, are Vietnam, Singapore, and the Philippines. So again, contact details will be at the end. So if you're interested to know more about life sciences in those particular markets, I can connect accordingly. And that's me. Handing over to Paul.
Lovely, Rahul. Thank you very much for that. Very, very interesting. We do have quite a few questions coming in. So those of you who are listening, please keep them coming. Rahul, I just want to linger on one of your points because you did mention earlier up in your, I think it was your first slide regarding the sort of different elements across the healthcare sector where there was support there and support which was being delivered by, I'm guessing, third-party sector delivery partners. So I just wondered whether you could sort of expand on a little bit of that and how could our SMEs sort of access that help?
Yeah, sure. So DIT, we have support both in the UK through our international trade advisor scheme. So we can link SMEs to international trade advisors who are based regionally, and they can basically discuss what your SME wants to sort of achieve and how to build the capability to actually export. They're a good gateway as well to our other services and other sort of products, such as overseas market introduction service, so we can provide market information, our trade access program as well, so there is help on accessing trade exhibitions across the world. And also we do lots of trade missions and events, which again we do in collaboration with third parties. We do lots of UK events as well, for instance, with UK-ASEAN Business Council, specifically around different sort of offer areas, so for instance, on digital or on, say, infrastructure. Once again, what our key sort of strength is linking SMEs to opportunities overseas. So we have a network of overseas advisors who sit in the embassies who are identifying those opportunities, and it's up to us as Healthcare UK to connect them back to an SME who would have a really good solution to deliver those. And overseas, we deliver that with third parties, including chambers of commerce who are in those countries as well. That's just a summary.
Brilliant, thank you, Rahul. So we do have a few questions coming in. Just a general comment which I want to make is that somebody's asked whether the slides will be available. The answer to that is yes. After the presentation, there will be a link sent out which will allow you to look at the webinar again, because it is being recorded, along with other webinars that we've done in the past, and the slide decks will be available there. So let's take a few questions. Talia, just something from my side to kick things off, really, because as you are aware, and maybe a lot of our organisations are aware, that we do have in-country partners in the region, mainly the British Chambers of Commerce, as Rahul mentioned there, who are delivering services. And as you're based in Singapore, I do understand that you head up the healthcare sector forum within the chamber. I just wondered whether you could sort of expand on that a little bit, what that does, and how our organisations here and how you and we can get them more involved and to look at the opportunities that you are obviously supporting.
Thanks, Paul. Sorry, I was just coming off of mute. Yes, so the Chamber, we have a sort of vibrant health and life sciences committee in Singapore, which covers Singapore, but also Southeast Asia. And there's a parallel committee in Hong Kong, which covers Hong Kong and Greater Bay Area. And we have a number of different strands of work that we do under the British Chamber banner. We do, of course, act as a platform to connect different parties, both UK companies, but also domestic companies from the different markets, or multinationals that are purely Asia focused. So it is a broad church, and we're very inclusive. And we tend to focus on the big challenges which are facing the healthcare system. We look at potential government advocacy work that we can do, solutions that we can put forward. So in post-COVID, we've set out a number of recommendations of things that the government could do to ensure the viability of the private care sector in particular. We also, of course, connect consortiums together. So if there are opportunities that require a number of different parties to be involved, it serves as a great platform for doing that. And we also have a sort of heavy focus on some of the key emerging topics that are beginning to surface, so things like digital. And we try again to look at what we would want to recommend to government in terms of regulation and in terms of permissible use of those products and services. So it's a broad remit, but it's a great, very vibrant, very inclusive environment for individuals and companies to take part in.
Excellent. Thank you very much for that, Talia. If I could go back to Rahul, and maybe also Talia may want to comment on this one as well. We have a question in. Really, if we could just have a little bit of a look at the healthcare education and training opportunities in a bit more detail.
Yep, sure. So healthcare training and healthcare education training. So what we do is we work with lots of trusts, so NHS trusts, but we also work with a lot of sort of private sector providers as well, who have solutions, who can deliver a certain program. So when it comes to trusts, it's very much around observership. So getting a sort of graduates or sort of aspiring medical professionals to come to the UK and actually observe how a trust actually does certain things around, say, diabetes or cardiovascular accordingly. But we also have on the other side sort of the digital ways of delivering education and training. So we work with organizations like Elsevier or Escala, who actually have solutions of creating these multi-dimensional programs where it is actually a mix of, say, digital training around a certain area, but also some experience both in the country and also in the UK. So Escala is a really good organization that does that. We are seeing quite a growth in terms of education and training demand from the UK, mainly because of our reputation of producing of our universities and of our trusts accordingly. So a lot of country sort of government ministries of health or private sector hospital providers look towards the public sector. But again, what happens is the public sector sometimes really does struggle to deliver those. So you can see how SMEs actually come in to help develop sort of partnerships with those public sector organizations to deliver them. But I mean, I guess in the era of COVID, I think it will stray more towards the sort of digital ways of delivering education, training, and programs. So it would be interesting. We do have an education training specialist who works in our organization, and if there's any interested SMEs or any SMEs who have some really interesting solutions, really happy to talk to them and see how we can link up with the opportunities accordingly. So open invitation to SMEs accordingly.
Talia, would you like to add on to that one?
Yeah, I mean, I think the one thing I would caution, and I've seen this across multiple markets, is making the presumption that the UK offer of healthcare education and training is in any way superior. So it is a fantastic model. It's got a great reputation. Of course, we know this, but no country, and particularly no medical institution, wants to feel like it's not up to scratch. So we always try to position these types of things within the context of shared learning. So UK's got something to learn, and also the host country's got something to learn. And we actually know that some of the very best practices around, for example, the management of cardiovascular care is coming out of India, is coming out of some of the specialist centres in China with outcomes which are better than some of the top teaching hospitals in the UK. We have to be very cautious, I think, about how we approach the issue of medical education and situate it within that something to teach, something to learn type model. So that's the only thing that I would say. The other interesting point, I guess, on teaching and development is we're seeing some of the big pharma companies actually going in and playing a really pivotal role in developing medical education programs. They're absolutely not aligned to brands, so they don't ever talk about therapies, but they go in and perhaps teach people how to deliver best-in-class osteoporosis care and provide some of those clinical guidelines. And of course, when you get clinicians following those guidelines, you get better care, but you also tend to get better prescribing, and that's the upside for the pharma companies. So we're beginning to see that as a market access activity for life sciences firms, which is quite interesting and very successful.
Lovely, thank you very much for those comments. And another one for I think both of you to also have a little bit of a comment on that is that and I know you, Rahul, mentioned it in your presentation, which was about the aging population. This one is based specifically for Singapore, where you've got that huge aging population there. And the question is, how do you see government supporting this issue, and what is needed, and how can UK companies sort of assist and hook into that?
Yeah. So as I said, in the government's industrial strategy, one of there are these grand challenges. So clean growth, AI. One of them is aging society, and what we're doing in more with our life science side in DIT is looking how we can harness that, how we can build a sort of UK offer around aging society, which includes medtech companies, digital health companies, organizations that have a new way of delivering care, say in social settings in the UK, and then promoting that overseas initially in Northeast Asia, especially Japan and Taiwan and Korea, because there is a great sort of demand there, but also in Singapore. We do see Singapore as being sort of the next the sort of market in Southeast Asia where we do this. I think what government support will happen is that we'll probably do more sort of inward trade missions, more outward trade missions around this but more probably virtually again because of the COVID situation. But also engaging business as well to see what sort of offers they have. So again, we have an aging sort of society specialist who's currently engaging the UK sector to see what is out there, so we can build this into what we're promoting to overseas buyers in Singapore accordingly. So we're sort of developing this into sort of a crescendo where we will actually promote the UK overseas and actually start getting opportunities to come back to the UK.
Interesting. Talia, could you expand on that as well?
Yeah, of course. So the the question was around the aging population. Yeah, so I think when we look at the aged care sector, I mean, the numbers are huge across Asia, and the infrastructure to deliver care to that sector is very low, and the need for innovation very high. The difficulty that we have is often what you need to put in place in order to create an efficient and effective care model requires so many partners. It's not just about having the service provider. It's also about having transport, logistics. It's about having some of those telehealth type services. So there is a need for companies, I think, to come together and to try to solve via a consortium type approach, and then go to payers. I think payers, whether they're public or private, find it very difficult to engage with 20 different companies in order to come up with one solution. So if companies can do that work and actually come with something turnkey which solves the problem in a cost-effective way, then it's kind of a no-brainer for payers to move forward with that. So it is going to require a lot of partnership activity. I think those in the aged care sector are probably used to it, but lots of the things that we have in the UK, like good ambulance infrastructure and all of these sorts of things, but when needed it doesn't exist. It has to be built into a solution. So that will be one of the challenges, I think.
Good. No, thanks very much on the comment there, and I think it just only goes to show that there are significant opportunities for organisations there to hook into these ASEAN healthcare sector. So look, guys, we've reached the end of our webinar. It's gone very quickly this hour, and I would like to thank all of our speakers for a very informative session on the healthcare opportunities ASEAN, and to all the attendees. I trust that has been useful for you. Finally, just to mention, our next webinar event in the UK-ABC Digital Export Series is Successful Growth in Malaysia. That's actually next week, the 2nd of June. We look forward to seeing you all there again. Registrations are still open on that one. A little bit about that is that as a new Prime Minister takes the helm in Malaysia, we hear about the early indications of the potential for increasing UK-Malaysia trade. Malaysia offers opportunities across a wide range of sectors for UK exporters as demand increases for a variety of goods and services. Our speakers on this one will be Jennifer Lopez, who's the Executive Director of the British Malaysian Chamber of Commerce, our colleague Vikram Kumaran from ASEAN Desk Director, Corporate and Commercial Banking at Santander, along with his colleague Hussam Sultan, who's the Regional Head of Commercial Islamic of the CIMB Bank in Malaysia. So thank you very much once again for listening. I hope that's been useful. Goodbye and enjoy the rest of your day.